Good afternoon, good evening, and good morning from North America, where I am. I'm Maren McKenna. I'm a journalist, an author, and academic in the United States, working in the space of public health and antimicrobial resistance. And I'm your moderator for this event today, in which we'll observe European Antibiotic Awareness Day 2024 by hearing from a fascinating array of speakers who'll examine the problem of antimicrobial resistance from a number of vantage points. As we all know, antimicrobial resistance, or AMR, as we'll probably call it through the rest of this event, is a global threat responsible for more than 1.2 million deaths per year and many million more illnesses, along with vastly increased healthcare spending and lost national productivity. AMR threatens to take us back to a pre-antibiotic era in which the most simple injuries and illnesses could pose a deadly threat from uncontrolled bacterial infection. Concern about AMR is not new, of course. Alexander Fleming, the father of penicillin, warned against its emergence when he accepted the Nobel Prize in Medicine in 1945. Yet for decades, it has been a mostly invisible pandemic, affecting people who are ill or disadvantaged or made vulnerable in a variety of ways by economic or social conditions, or simply people with no prior vulnerabilities who've had the misfortune to be visited by an antibiotic-resistant infection that upends their lives with no explanation. Because of that invisibility, AMR, for the most part, has not received the sustained national and international attention it deserves. In particular, its victims have not received a sufficient platform to tell their stories. To remedy this, the World Health Organization has proposed this message to attach to discussions of the problem. AMR is invisible, but patients are not. And at the same time, the European Centre for Disease Prevention and Control is launching publication of a series of patient stories in hopes of better illuminating the personal and social havoc caused by antibiotic-resistant and antifungal resistant infections. In agreement with that WHO statement and that ECDC initiative, this event today will focus on patients' own narratives. We'll hear from patients themselves, from organizations which serve them directly, and from public health and research organizations which are exploring AMR's long-term and potentially deadly consequences. So let me tell you how this event will work. We'll be hosting two panels, the first composed of distinguished experts, and the second showcasing the experience of patients and patient organizations. In each panel, each speaker will have no more than 10 minutes to discuss their particular views and initiatives. And following all of the panelists speaking in each panel, we'll host a Q&A for each, in which each panelist will get to answer one or more questions. We have a lot to do. I'll be quite strict about the time, and I will introduce you, the viewers, to the slates of panels at the top of their respective time slots. But before we get to that portion of the program, we'll begin by hearing directly from a patient in a video prepared by the ECDC. Thank you for your attention to this introduction, and let's begin that video now.
When I was young, I used to be told about my condition and what the future looks like and different treatments that I'm going to have to do. What I wasn't told at the time was the number of antibiotic-resistant infections and sepsis that I would experience. My name is Gavin Schranz. I'm 26 years old and I'm from Malta. I work in the healthcare IT industry, and I've recently completed a Master of Science in Digital Health from the University of Malta. My master's thesis focused on using digital tools to educate the public on the prudent use of antibiotics to preserve them for the years to come. My hobbies involve taking my dog out for walks, taking my dog to the cafe or taking my dog anywhere. So I'm a renal patient. I'm currently undergoing hemodialysis, and I'm in the final preparation for a nephrectomy, which are the removal of my kidneys, and for a kidney transplant from a live donor. It all started when I was born. I was born with a kidney condition, and over the years it got worse and worse, and we've had to do a number of series of operations and surgeries to mitigate and to push back as far as possible a kidney transplant. When I turned 15, I had a rather major surgery, a reconstruction. And whilst this surgery was successful, it led to a number of infections post-surgery. And I was in hospital, in and out of hospital for a couple of months with quite severe infections. And I was always taking different courses of antibiotics to tackle these infections. Unfortunately, these infections were rather severe. They led to quite harsh pain that was only treatable with doses of morphine to reduce them. These infections and these episodes post-surgery ironically led to more hospitalizations and hard times than the kidney disease itself. So the repercussions of the treatments and the surgeries to tackle the kidney disease led to infections that to me are the hardest to deal with. My latest infection actually was in my fistula that is used for my dialysis sessions. I got MRSA and I couldn't use the fistula until the MRSA had passed. So this was quite a difficult situation because I was using a neck catheter until I could use the fistula. And that was treated again with second-line antibiotics. Luckily, my mom is a doctor, so throughout this whole process and throughout my years, she's been able to help me immediately with any problem that I have, be it at home or at hospital. And we're a family of 5 kids, so it's not easy when one of your children is hospitalized and you have to stay with them and you have to care for them whilst also giving time and care to your other children. I can't imagine what it's like for my siblings and for my family to see again and again these difficulties. And at times I was so distracted and I was so oblivious to my surroundings because of morphine, painkillers and whatnot, that it was actually my family and my closest friends that used to suffer even more than me trying to do something when there is nothing to do. From all these infections and hospitalizations and difficult times, I've learned a number of key lessons over the years. Hand hygiene is super important. We interact with a lot of different people, objects, and it's important to keep our hands clean because we can not only bring infections onto us, but give infections to others. And another important lesson that I've learned is to never self-medicate, to never take antibiotics without a prescription from my doctor. It's very important that we take antibiotics only when they are prescribed to us. So what's important is that everybody realizes that AMR can affect them either now or in the future in different ways. It is not only people with medical conditions, and what you do affects the community as a whole. So as I approach the removal of my kidneys and the kidney transplant, my priority for these surgeries is that if or when I do have an infection post-surgery, there will be good enough antibiotics to tackle that infection.
Such a moving presentation from that patient, and such a concise statement of the depth and seriousness of this problem. And now we're going to turn to our first panel of experts who are going to talk about a number of dimensions of the problem of AMR. I'm going to tell you who they all are in the order in which they're going to be speaking. So first, Pamela Rendi-Wagner, the director of the European Centre for Disease Prevention and Control. Then Rosa Domenech, Director of One Health in the Directorate General for Health and Food Safety of the European Commission. Then Emer Cook, Executive Director of the European Medicines Agency, followed by Bernard Wuerl, Executive Director of the European Food Safety Authority. Then Danilo Lofo Wang, who's the AMR Regional Advisor for the World Health Organization's Regional Office for Europe. And finally, Irene Norstedt, Director of People, Health and Society in the Directorate General for Research and Innovation of the European Commission. Each of these people will give their presentations. At the end of all of their presentations, we will have a round of questions. I do want to mention that, unfortunately, the director of the European Centre for Disease Prevention and Control, Dr. Rendi-Wagner, will not be able to stay for the Q&A, and I will introduce her replacement when we get to that point. Dr. Rendi-Wagner, please go ahead.
Very good afternoon from the European Centre for Disease Prevention and Control here in Sweden, Stockholm. Well, the patient story we just watched is indeed a timely reminder of the people behind the data, behind the statistics and the numbers. AMR is an invisible, very silent threat, but the people, the patients, and the families are not. And I want to thank this very brave young man for sharing his story with us today. He reminds us that working jointly towards our 2030 goals and targets on antimicrobial consumption and resistance is crucial more than ever. ECDC estimates that over 35,000 people die in the European Union each year as a result of infections resistant to antimicrobials. And moreover, 4.3 million patients in the European Union and EEA countries acquire at least one healthcare-associated infection during their stay in a hospital. Many of these hospital-associated infections are resistant to antimicrobials. This is a problem, and this problem is huge. European Antibiotic Awareness Day is an opportunity to take stock of where we are in the fight against AMR. So today I would like to cover mainly three areas. First, where do we stand? Where do we stand in the fight against AMR? Second, what is needed to maintain these very important vital treatments? And third, what can ECDC do to support Europe and European member states? Well, first, where do we stand? Today, ECDC is releasing new data tracking EU's progress on antimicrobial resistance and antimicrobial consumption against the 2030 targets, which have been adopted only recently last year by the European Council. Well, what does the data show? Well, there has been some progress, but overall, Europe is still trending in the wrong direction. Antibiotic consumption in the European Union has increased by 1% since 2019, moving us further away from our 2030 targets of a 20% reduction. Well, while some resistances have decreased, have increased by even 60% more highly resistant bacteria, such as the carbapenem-resistant Klebsiella pneumoniae. Why is this worrisome? Well, this increase is worrying as very few options remain. available to treat patients infected with these highly resistant bugs. Progress in the European Union is only as good as the sum of the progress each member state makes. Here too, we see a very uneven picture if we look at the different member states. So some member states are making more progress than the others, and some even reach their targets. So today we are calling for action in three main areas. First, infection prevention and control. Second, prudent use of antimicrobials. And third, promoting development of and access to novel antimicrobials. First, infection prevention and control. Why is this so important? Well, we know that healthcare-associated infections account for 10% of AMR-related health burden in the EU. And this is why hospitals must prioritize on very, very basic measures, but yet critical measures, like adherence to hand hygiene and disinfection. It needs adherence to basic guidelines regarding hygiene in the hospitals. It needs better screening and isolation of patients with resistant infections. And additional, it needs more trained staff for infection control in the hospitals. It needs more training to fight AMR in the hospitals. Secondly, on the prudent use of antimicrobials, we must ensure that antibiotics are used appropriately, only when they are really needed. ECDC therefore advocates for comprehensive stewardship programs to promote the right choices in antibiotic prescribing. This work must happen in the hospitals, but also at the community level. This is important because we know that the community sector accounts for 90% of all human antibiotic use. So public awareness campaigns are needed as well. These should be complemented by social and also behavioral interventions to ensure they have the right impact in the communities and the groups who really intended to be targeted. Third, the third area where we need continued progress is the development of and definitely access to novel antimicrobials. We need this for treating the patients with infections that are resistant to even last-line antibiotics. So finally, I would also like to talk about ECDC's extensive work to combat AMR at the European level. We work very, very closely with our partners across the sectors with a One Health approach. In 2025, ECDC will support the European Commission to develop the EU guidelines on infection prevention and control in hospitals and long-term care facilities. And these will be the first time in history EU-centered standardized guidelines. Moreover, through our AMR country visits, we also support the member states directly. We support them directly by technical expertise to develop strong national AMR action plans. Moreover, ECDC has begun public health emergency preparedness assessments in all EU countries, and AMR is a key focus in these assessments. Additionally, through our regular surveys, which are the point prevalence surveys, ECDC provides updated data on healthcare-associated infection, antibiotic consumption, and also AMR across EU, EEA countries. So let me conclude. The battle against AMR is one we must fight definitely together. We all have a role to play. The policymakers, the healthcare providers, the patients, the doctors, you and me. Yes, let us not forget, behind statistics, behind numbers are real people, patients, families, communities whose lives were affected by AMR. AMR is invisible, but the victims are not. So fighting AMR means saving lives, and it also means protecting our healthcare systems. Thank you.
Thank you so much, Director Randy Wagner. Let me now introduce Rosa Domenech, Director of One Health in the Directorate General for Health and Food Safety of the European Commission.
Thank you, Marin, and thanks also to the ECDC for organizing this event year after year, and obviously very happy to take part in it again. Actually, when we see all the figures that Pamela mentioned, one wonders why we still call it silent or invisible pandemic. I mean, the latest figures that the Lancet gave, estimating that almost 40 million people would be dying by 2050 due to AMR. I think they are self-explanatory. Not to mention that the so-called superbugs could threaten food security for over 2 billion with people and raise annual healthcare costs by up to 159 billion dollars. In Europe, 1 in 5 bacterial infections is resistant to existing antibiotics. Without urgent action, we're facing a grim future where antibiotics no longer work, with devastating consequences, as Marin said in her introduction, across all areas of healthcare, from neonatal care to cancer treatments and surgical procedures. And within a generation, it could surpass cancer as a leading cause of death. Pamela has just spoken at length on the slow, even negative progress towards the 5 targets related to antimicrobial consumption and resistance to be reached in 2030. With the caution that is needed in the interpretations of these figures, they are still a very strong wake-up call. Things are not moving in the direction that they should, and there must be much stronger measures to address this, particularly in healthcare settings. However, if we want to find the silver lining in the dark cloud just presented, this shows just how important it is to have clear and concrete targets to monitor and measure our progress in fighting an AMR. Every effort must be made to turn things around. We firmly believe that with the right effort and resources, the 2030 targets can still be met. As you know, addressing antimicrobial resistance has been a priority in the EU for decades, and it will remain so as long as AMR is not under check. Not only it is in the mission letter for the Commissioner designate, but also a priority in the European Parliament, and you could see this also during the hearing, and also obviously for the subsequent Council presidencies. The Commission will continue working hand in hand with Member States to strengthen national action plans and to improve infection prevention and control, surveillance and monitoring, and prudent use. Our joint action to support Member States in this endeavor is underway since the beginning of this year. In the area of innovation, we're discussing with the other institutions our proposed revision of the EU's pharmaceutical legislation, in particular on transferable exclusivity vouchers, as the most audacious solution for driving the development of urgently needed innovative antimicrobials. You will most probably also hear from Emer and Irene today on other ways in which the EU is supporting research and the development of new and effective antibiotics. One word now on One Health, because we're also working closely with the medical, veterinary, agriculture, scientific and environmental sectors through the One Health approach when addressing AMR. It should be noted that in contrast to the bleak figures on human consumption today, there has been very good progress in the food and veterinary sector to improve biosecurity and reduce antibiotic use. As you know, the EU veterinary medicines legislation curbs the use of antibiotics in the agri-food sector and prohibits their use as growth promoters. And this is already reaping results, and I'm sure that Bernard will, in EFSA, will provide us with more details in his presentation. On the environmental side, tough new monitoring measures at EU level will help us to better survey the presence of antibiotic residues in water and soil, and that will help to take appropriate countermeasures in their environment too. On the international sphere, we have been pushing for strong commitments and at global level in the context of the negotiations of the UNGA political declaration. And we've just been present in Jeddah last week to endorse the first steps of its implementation. We're also championing One Health and AMR in the context of G20 and G7. Next week, I'll be participating in a big meeting with stakeholders organized by the Italian presidency. And we continue working very closely with US, Canada, Norway, and the UK through the Transatlantic Task Force on Antimicrobial Resistance, TATFAR. The next meeting is actually in 1 month in December. And now I come to probably the most important measure against AMR. As Pamela said, awareness raising. Involving patients and the public is vital for fostering a whole of society response, as the initial video showed. Testimonials are among the most effective ways for raising awareness, and as patients, survivors, and caregivers share firsthand in experiences of antibiotic use and its impact, helping shape people and patient-centered solutions. AMR awareness must also trickle down to the younger members of the society so that understanding and good practice can start at a crucial age. Empowering these young people with good knowledge of AMR and guiding them to responsible antibiotic use is crucial to mitigating it. And of course, it must be done in a language that they relate to and in an engaging format that is entertaining and as well as educational. This is why we've developed a free online game titled Beat the Bug on the Fortnite creative platform, very well known by teenagers. Schools, universities, parent-teacher associations, and community organizations must boost antimicrobial resistance awareness in their educational settings. So we have also developed an educational material and lesson plans for parents, teachers, health educators, and community groups. They aim to guide teenagers in practicing basic preventive measures and promoting responsible antibiotic use by understanding the machinations of microbes, bacteria, viruses, antibiotics, resistance, and the miracles and mysteries of the human body. To conclude, as Pamela was saying, tackling any AMRs requires sustained commitment across sectors, countries, and communities. We are at the turning point, and the steps we take now will determine our ability to safeguard public health in the decades to come. By working together through initiatives like the ones mentioned here today, we can build a future where effective antibiotics continue to protect human health, allowing future generations to benefit from the medical advancements we have actually achieved. Thank you very much.
Director Domenech, thank you so much. Let me now introduce Emer Cook, Executive Director of the European Medicines Agency.
Thank you very much. And can you hear me? Great. So it's a real pleasure to join you here today. And I'd like to thank you, Marianne, and also the ECDC for putting this event together. As you've heard from the previous interventions, antimicrobial resistance is a challenge for all of us, and it's an area we need to work on together. So I want to tell you what we're doing at the European Medicines Agency perspective. It's really an honor to join you in this important event, which marks European Antibiotic Awareness Day. And I think I was particularly struck by the intervention from our patients and the video that was shown, because really this year's theme, Antimicrobial Resistance is Invisible, I Am Not, highlights the real impact of antimicrobial resistance on people's lives. So I want to complement what you've heard from the ECDC and the European Commission by telling you what the European Medicines Agency and medicines regulators in Europe and worldwide are doing to try and counter this threat. So firstly, we play a crucial role in encouraging the development of human medicines and vaccines, and also the development of medicines for animal use. But the reality is that the medicines pipeline for antibiotics is not as strong as we would like it to be. And in fact, it has been drying up significantly over recent years. And of course, this shouldn't come as a surprise to anyone. We're asking for products to be developed that we actually hope not to use. So this means that the economic incentives are low, but it also means that the implications are very high. So this means that discovering and bringing new antibiotics to the market is often not profitable for companies, so we don't see the commercial investment that we would like to. But we have some recent examples where public funding has contributed to the development of new medicines. And I'll give you an example of a recent antibiotic called Emblavio. Emblavio was co-funded by the pharmaceutical industry and the Innovative Health Initiative, and it's a new antibiotic for difficult to treat multi-drug resistant infections, such as hospital-acquired pneumonia, infections of the urinary tract, or infections caused by certain types of bacteria, particularly those where the treatment options are very limited. And of course, this is very encouraging because these types of infections are estimated to cause 35,000 deaths in the EU every year. So you'll be hearing a bit more about this from DG Research later. Now, the question we need to ask is, what can we do to stimulate medicines development further? And what we're doing at the European Medicines Agency is encouraging early interactions with developers. But we also need to think of what incentives we have for developers. And this is where the work of the European Commission comes in, because the voucher system proposed in the new pharma legislation is promising. It gives companies who develop priority antimicrobials a voucher for an extended 1-year additional market exclusivity. And companies can use this voucher for any authorized medicine. So it can be a completely different product in a different therapeutic area. So this is one of the possible incentives that we will have at our disposal. But I also wanted to talk again about how we use antibiotics. So we need to make sure that the antibiotics we already have are used in the best possible way. And that means we have to talk about optimal use of these antibiotics, but also we have to talk about how we link this with better diagnosis. More and better diagnostic tools at the point of care will help ensure that patients can be started on the right antibiotic without lengthy trial and error, or indeed not started if antibiotic use is not necessary or appropriate. And getting this right involves continuously raising awareness and educating healthcare professionals, but also citizens about appropriate and prudent use. We also have challenges with falsified and substandard products and supply outside pharmacy or without prescription, which can exacerbate the problems with antimicrobial resistance. The most important message I can give is that to use antibiotics prudently when they are needed and only based in accordance to prescription. No more is necessary and no less than is necessary. This is a message we need to communicate far and wide. Now, at the European level, we are responsible for the authorization of both human and veterinary medicines. And AMR is a prime example of the One Health approach because it shows how interlinked human and animal health are. On the veterinary side, we have a remarkable success story to tell. One of our past projects, which was a collaboration with our national competent authorities, was the European Surveillance of Veterinary Antimicrobial Consumption, ESVAC. It's been hugely successful in reducing sales of veterinary antibiotics in the EU. EMA started this project in September 2009, following a request from the European Commission to develop a harmonized approach for the collection and reporting of data on the sales of veterinary antimicrobial products from EU and European Economic Area member states. Now, ESVAC started off as a voluntary project. It was a concerted effort by farmers, vets, national authorities. But the big success is that it led to sales of veterinary antibiotics in Europe dropping by more than 50% over 12 years. So the success of this project shows us that we can reduce AMR through a combination of monitoring, collecting data, and communication. Now, these principles are now clearly embedded in the EU legislation, and we move now from a voluntary situation to the collection of data on sales and use of veterinary antimicrobials being mandatory for all member states. So in January of this year, we launched the Antimicrobial Sales and Use Platform, the ASU, and this is the successor to the ESVAC. And this is a cutting-edge system which is designed to standardize and streamline the collection of data from all member states and beyond. As we build on the success and the principles of ESVAC, we will be able to identify trends in antimicrobial consumption more accurately. And this means that we can take better decisions to protect both animal and human health in Europe. Data from this platform will be used to monitor the effect of implemented measures both nationally and at the EU level and help us to identify concrete targeted actions. The scope of the data has been expanded to include even more antimicrobial classes than ever before, which allows us to address the increasing complexity of resistance across the EU. We know that countries that have decreased their consumption of antibiotics in both animals and human have seen a reduction in antibiotic-resistant bacteria, and this is clearly outlined in the 4th JIACRA report, which was published jointly by ECDC, EFSA, and EMA. Access to reliable data on consumption and resistance in people and animals makes a huge difference. Through joint projects like the JIACRA, European countries get invaluable insights on the impact of measures they take. This enables them to take further action to promote the prudent use of antibiotics. Our work does not stop there. We know we can only solve this health crisis by partnering at the EU and international level. And this panel today is an example of our European partnership. But last week, I co-chaired a discussion at leadership level among global medicines regulators, and we committed to intensify our actions and our collaboration. We cannot work in isolation. We need ongoing collaboration and collective action across all sectors: human health, animal health, agriculture, and environmental science. At the center of all our efforts are patients like the patients we heard this morning, and these patients are relying on us. As our previous panelists have said, awareness raising and improved education are key. So to conclude, we have a collective responsibility to develop a more comprehensive global strategy to address AMR effectively and preserve our ability to treat infections and save lives. The impact of AMR on everyone's life is profound. By addressing antimicrobial consumption at every level, from farms to hospitals, we contribute to safeguarding our communities, our patients, and our futures. Our actions today to curb AMR will save lives in the years to come. I want to end by thanking all our partners, including member states, including our vets, our farmers, our public health officials, and many others for their unwavering commitment to this common cause. Our collective efforts will contribute significantly to the global fight and making sure people, healthcare professionals, patients, everyone understands better this health crisis and what we can do about it. Thank you very much.
Executive Director Cook, thank you so much for those remarks. Let me now introduce Bernard Oerle, Executive Director of the European Food Safety Authority.
Thank you very much. I hope the audio is fine now. It seems to be, yeah, it is. Thank you very much. And a big thank you to our colleagues in ECDC for organizing this Awareness Day and for bringing together this panel to look at AMR from very different perspectives, but to meet all of these perspectives in through one health approach. And we have heard before from the patient that AMR and nosocomial infections are a huge problem, but this isn't just a problem for hospitals or healthcare workers. It impacts agriculture, the food we eat, and ultimately every single one of us. And at EFSA, the European Food Safety Authority, we understand this deeply, and we take a 360-degree approach to tackling AMR because, as we have heard, no single measure, no single organization can solve this alone. The European Union has set an ambitious goal. By 2030, we aim to reduce antimicrobial use in animals by 50%. Why animals? Because the use of antimicrobials in food-producing animals plays an important role in the AMR challenge. By limiting their use to the absolute minimum needed to treat infections, we can reduce the risks. And this goal is part of a broader European One Health Action Plan against AMR, which EFSA has supported since its inception in 2017. And this plan rests on 3 pillars: making the EU a best practice region, boosting research, development, and innovation, and also, from an EU perspective, shaping the global agenda of fighting AMR. But what does this mean in practice? It means monitoring, sharing knowledge, and using cutting-edge science to guide policy and action. Each year, EFSA, together with ECDC, publishes EU summary reports, which provide detailed data on AMR trends. And these reports are essential for understanding where we are making progress and where we need to do more. Now, let me share some of the latest figures from our monitoring efforts. Every year, we analyze antimicrobial resistance in key bacteria found in animals and in food derived from animals. 2 key indicators are particularly important and interesting. One is the complete susceptibility in indicator Escherichia coli bacteria, a measure of how effective antimicrobials remain. And there are some good news. 3 years ago, only 25% of member states showed an increasing trend in susceptibility. This year's 64% of reporting countries, which is 18 out of 28, showed an increase. And secondly, we watch carefully the prevalence of ESBL and AMC producing E. coli, which are resistant to some of the most critical antibiotics. Again, 3 years ago, 48% of member states reported a decreasing trend, and this year we have reached 77%, which means 23 out of 30 reporting countries. And I think we can say these figures are really encouraging, showing that collective efforts across Europe are paying off. But they also highlight disparities. Resistance levels still vary widely between countries, and resistance to some commonly used antimicrobials remains frequent in food-producing animals. We are particularly vigilant about resistance to critically important antimicrobials, those reserved for serious human infections. While combined resistance to these remains low, we must stay alert. For example, resistance in Salmonella and Campylobacter, which are commonly found in food-producing animals, still remains concerning. And then there is carbapenem resistance. Carbapenems are last resort antimicrobials for humans. While resistance in animals is rare, it has been detected now for several years in different mammal states and different animal species. And genetic determinants of this resistance are often the same as those increasingly found in humans. This is for sure an area that demands close monitoring and further investigation. At EFSA, we believe that innovation is our greatest ally in tackling AMR. We are increasingly using whole genome sequencing as an advanced tool that allows us to better understand AMR and its spread. I think we can say we've also made significant strides in how we share and present data. Through interactive dashboards, story maps, and tools like DataViz, we make our findings accessible to policymakers, researchers, and the public. And these tools don't just present data, they tell the story of AMR, helping stakeholders take informed action. I would like to say that we are also exploring new dimensions of AMR. For example, how does antimicrobial resistance spread through reclaimed and recycled water? As we move towards a circular economy, we see more reclaimed water being used in agriculture for irrigating fruits, vegetables, and herbs. While this is a positive step for sustainability, it raises new questions about AMR. To address these concerns, EFSA has launched new projects to optimize detection methods and study the occurrence of AMR in reclaimed water. Similarly, we are examining AMR in aquaculture animals, also an increasingly important sector. We've published technical guidelines for an EU-wide baseline survey covering everything from sample collection to data reporting requirements. So, what's up next? Looking ahead, EFSA is committed to the three guiding principles: reduce, replace, rethink. Reduce the use of antimicrobials in food-producing animals to the least amount needed. Replace them whenever alternatives are possible, like phages, prebiotics, probiotics, or vaccinations. And also, most difficultly, rethink how we approach livestock production and food systems. And to see the big picture, this isn't just about safeguarding public health, it's also about ensuring that European food systems remain sustainable and competitive. Finally, as we prepare to review the EU's monitoring approach for 2028 to 2034, we remain focused on evidence-based action. Our goal is to harmonize monitoring efforts across Europe, ensuring that we collect the right data to protect public health. Let me end with this. AMR is for sure a global challenge, but it's one we can address together. At EFSA, we are committed to doing our part and we are proud to stand alongside our partners, policymakers, and the public in this fight. And I'm convinced together we can ensure future where antimicrobials remain a cornerstone of public health and not a lost tool of the past. Thank you.
Executive Director Url, thank you so much. Let's now go to Danilo Lo Fo Wang, who is AMR Regional Advisor in the World Health Organization's Regional Office for Europe.
Thank you, Marian, and thank you, ECDC, for inviting me. I'm very happy and very proud to be among this distinguished panel, and happy that WHO Europe can contribute to this important day, as we have for the past 12 years at least. So I will not be showing any data or any technical work that we're doing. I'm trying to stay true to the topic of today about our efforts, trying to adapt a patient-centered approach. So the thinking about patient-centered approach, of course, has quite a history in WHO. And some of you may know that last year, our colleagues in headquarters took the approach of the patient pathway and did a bit of a root cause analysis to see all the challenges that people meet when they enter the health system. And they looked at these challenges at different parts of that pathway, like prevention of infection, access to health services, diagnosis, and access to treatment. And this patient pathway formed the basis for the 4 pillars of the people-centered framework that was launched, I think, earlier last year. But here in the regional office, we took a bit of a different approach. We focused very much on things like the doctor-patient interaction. And we launched this antibiotic-free prescription, which basically is a checklist that guides the discussion between the physician and the patient. And here you see sort of the inside of that checklist, where the doctor can go through some of the symptoms with the patient, come with a diagnosis, and ultimately a recommendation, which in many cases would be not to take antibiotics. At the same time, the patient is informed about what they can do, and also for the signals to watch out in case things get worse, and then who to contact. So the intended effect is that it's a good discussion between the doctor and the patient. It's a sort of a co-designed way forward. The patients feel listened to and helped, and hopefully it will prevent lots of unnecessary prescription. But also at the same time, of course, we want to continue to inform both general practitioners and patients, and we developed these posters, and some examples are here. The 2 ones on the left are for the doctor's consultation room to remind the doctor of when and when not to prescribe, and if to prescribe, to prefer the antibiotics that are in the excess part of the list. On the right hand, you see a poster that is designed for the waiting room, where patients can mentally prepare themselves of the fact that they may not get an antibiotic and why not. But we want to go from patient to people. We want to take a broader approach and really reach people before they become patients. And this is why exactly a year ago, we started a social media campaign called Stories of AMR. And so we started collecting stories from all over the WHO European region, and every week we're posting a story from a person from a country. So I hope you've seen some of these on either LinkedIn or Instagram or other social media platforms. But while we were collecting these stories, we also thought we could use it for something else. So we designed this AMR exhibition on the stories, and we launched it during the regional committee of the WHO European region last year in Astana, Kazakhstan, where all 53 member states from the region came together and adopted the AMR roadmap for the region. Then we, of course, could reuse the exhibition, and we used it here for the Awareness Week a few weeks later last year. And also in May this year, it was part of the backdrop of the media corner at the World Health Assembly. And there it really got a lot of attention. And then from there, we thought, well, we could take these stories somewhere else. And the next big occasion, of course, was the recent UN General Assembly, where we launched this booklet. It's a sort of like a coffee table size booklet with 53 stories, one from each of the countries in the European region. Real stories of real people from all walks of life, all ages, and as I mentioned, from all over the region. So in addition to a little bit of an introduction of what antimicrobial resistance actually is, in the simplest language possible, we dive into the stories from each and every country. As I mentioned before, they're not all patients or survivors. Many of them are somehow related to the work, to the health system, but not all of them. For example, we have here a dentist from Bosnia and Herzegovina. We have school children. We do have patient stories. We have stories of a restaurant owner in Georgia. We have collected stories from both AMR ambassadors from Germany and Sweden. And the chief medical officer of Hungary provided a story, for example, and so on and so on. Midwife, etc., veterinarian. But we also use these stories, people's stories, to illustrate some concepts or to make a point. And just a week ago, we launched the resource guide for the AMR roadmap that I just mentioned. And here we use these stories for concepts. For example, there's a story of a youth leader to talk about community engagement, story of a patient to talk about treatment, of course, story of a microbiologist to talk about the laboratory functions, and a story of a nurse to talk about the role of healthcare workers. But we also go a little bit more in depth, and earlier this year we launched this publication, which is a people-centered approach to tackling antimicrobial resistance, which is directly linked to the AMR roadmap that I mentioned before. And here, just very briefly, there's no time to go into any detail. Here you see in this circle these 5 major action areas that are part of the roadmap and 6 enabling areas around it. And the sort of text bubbles that you see are short explanations of what a people-centered approach looks like in these action areas. We also use a patient story, a real patient story of a brave young woman who shared what actually happened. And in the same box, we also write what could have happened if a people-centered approach had been taken. And then we take it one step further from awareness to behavior. And we have an example of how to improve behavioral and health outcomes through a better understanding of the barriers and the enablers that people are facing. And this is one of these work examples. This publication also has some more tools and resources, such as to reduce inequities, to engage people and communities, and how to apply these behavioral and cultural insights to tailor interventions. This is very much linked to a series of guidance that we published already a few years ago, and it is a tailoring antimicrobial resistance programs, which is using behavioral insight methodology to help set up targeted interventions, also in the population. And we have some of these projects going on right now, including in Malta, and I was very, very touched by the patient story with which we opened this meeting today. And hopefully our targeted work will also benefit him and others in the region. And finally, also we are using people stories when we launch ideas and initiatives. And for example, here, when we started working on building the evidence for the use of bacteriophages against antimicrobial resistance, we published this on our website together with a story of a survivor who survived not because of antibiotics, but as a final resort through bacteriophage therapy. And of course, also we need to know more about the underlying behavior. And here we've had some very close collaboration with our colleagues at the European Commission and ECDC. And we performed a survey based on the questions in the AMR Eurobarometer across 14 member states that are not part of the European Union. And we saw some very interesting commonalities in terms of behavior and attitudes, but we also saw some significant differences. And of course, this knowledge can be used to set up targeted interventions. We also made a quiz actually for last year for the regional committee, but it's still up and available. And the idea behind it was for people who do not know a lot about AMR, or maybe just a little bit, or a one-sided view, to basically go through what AMR is and meet some hopefully amazing facts. So with that, I will leave you now with one final message and saying that AMR is everyone's responsibility. Thank you for your time.
Advisor Lo-Fo Wong, thank you so much for that fascinating discussion of patient-centered stories. I want now to introduce Irene Norstedt of the People, Health and Society in the Directorate General for Research and Innovation of the European Commission. She is our last speaker in this panel.
Thank you very much, Marilyn. And it's a tall order to be the last speaker of this event, but I will try to do my best to provide some new aspects in here. So thank you so much for inviting me to this event today on the Antibiotics Awareness Day. And it's really important that this event takes people's lives at the center of this discussion. And as we have heard, antimicrobial resistance, called the silent pandemic, might be perceived invisible, but as we have heard and as we see, the impact on people's life is not. So any of us can be affected by antimicrobial resistance. So it's not only a threat that is restricted to vulnerable patients. It is almost 100 years ago that the world of medicine was revolutionized by the discovery of penicillin, making the beginning of the antibiotic revolution that really transformed modern medicine. But as you also heard AMR mentioning, there has been a gradual decline in antibiotic discovery and development. Their overuse, misuse, and evolution of drug resistance in pathogens has really been astonishing over these last decades. And this is also, of course, why this will continue to be a key priority for the European Union. And you have already heard my colleague Roser mentioning this as a priority for the coming Commission. And you have also heard about the Council recommendation to strengthen the Union's response against antimicrobial resistance that was launched in 2023. And of course, several actions must be taken to improve the progress towards the objectives that was set in this. And of course, research and innovation is vital and cannot be overestimated on this field. And we have done a lot over the EU research program Horizon 2020 and Horizon Europe. We have invested more than 1 billion to support research and innovation related to AMR. And this has gone to better understanding of transition mechanism of antimicrobial resistance among humans and among human, animal, and the environmental sector. And we have also supported developments of new tools for detection, prevention, treatment of infections, such as antibiotics and alternatives to them. I'm aware that often citizens do not see the benefit of research and innovation in their daily lives because research makes progress behind the scenes. And research in this area is challenging. It's complex and developments take a long time, especially when it comes to the search and development of new therapies and diagnostics. And for this also, we see research cooperation between stakeholders an absolute must. You also heard AMR mentioning the challenge with developing new antibiotics. And that in reality, we are trying to develop something that you only want to see very rarely being used. And that is, of course, a challenge where we absolutely need to have new incentives to really engage more interest into this area. But I would like to present you a very tangible example, which also links to AMR's presentation. In our very first generation of our public-private partnership with the pharmaceutical industry, the Innovative Medicines Initiative, we set up a very big program called New Drugs for Bad Bugs. And one of these projects in that portfolio was the Combat Care project. And this is the project that has contributed to the clinical development of the novel antibiotic Emblaveo, that received the EU market authorization earlier this year. And Emil already mentioned to you also that it was the first beta-lactamase inhibitor combination therapy that intended to treat very serious gram-negative bacterial infections in adult patients. And it really provides new hope to critically ill patients affected by antimicrobial resistance. It's a result of a fruitful cooperation between many scientists and clinicians and industry over several countries over many, many years that eventually translated into important addition to the scarce arsenal of antibiotics to treat drug-resistant infections. And without the efforts of researchers that worked together for so many years, this newly developed medicine would never have reached the desk of regulators nor the shelves of pharmacies and doctors to treat patients. And it clearly exemplifies the call for further cooperations of this kind. And it's something that comes back to us again, and this is a really pointing case for this area. We absolutely need to work together. And one of the tools we have in our research program at the EU level, Horizon Europe, is the partnerships, the European partnerships. And such partnerships brings together the funding of the European Commission with private and public partners, and that to address some of Europe's most pressing challenges through concerted research and innovation initiatives. And that also helps to reduce fragmentation of research and innovation and mobilizes funding from all partners towards common objectives. And here we are just about to set up a new European One Health AMR partnership that will be launched in 2025, and with a contribution from Horizon Europe with up to 100 million euros. This partnership will aim to reduce the burden of antimicrobial resistance with an extended integrative program to better understand, prevent, and treat AMR. And this partnership will take a holistic One Health approach to attain optimal health outcomes, especially taking into account the link between health of humans, animals, plants, and our shared environment. But we have also other tools to fund research and innovation, such as the European Innovation Council that funds innovative solutions by SMEs, and they already have a portfolio also of AMR products. And we also have a cooperation between the Commission and the European Investment Bank under the HERA Invest initiative. I would also like to draw your attention to the coming applicant-driven calls that will be launched in 2025 by the Innovative Health Initiative, which is the third generation we have of a partnership with industry, this time with all the health industries, so not only with the pharmaceutical industry, but also the biotech, the diagnostics, medical devices, and the digital health industries. And with these applicant-driven calls, they are sort of disease agnostic, so AMR projects are welcome to be submitted also here. But we shouldn't forget to also better integrate social science and behavioral sciences to ensure that we do have the right behavioral and social context and also geographical context to be considered at all stages of our planning and implementation of research and innovation. And in fact, the involvement of the social sciences and humanities is very important because what we see is that new innovative approaches often comes from cross-disciplinary discussions and work. So this is something that should be reflected when the research is set out and not as an afterthought as it's often done today. We should also work much more with citizens and communities, including civil society and patients' organizations. And that should, of course, also represent all ages in every step of the healthcare innovation to make sure that new innovative solutions and scientific discoveries are trusted and accepted as well. In addition, and you have heard several of the speakers today talking about the need to work on the One Health approach. For this, we need to better break silos by supporting integration and cooperation between different scientific communities and connecting people for better integrated and systemic approaches in a wide range of activities. And our aim must be to have a sustainable balance and good health of humans, animals, and the ecosystems. And I will conclude here, and of course you can count on us to continue to support science to address our key societal challenges, antimicrobial resistance being one of them. Thank you.
Director Norstedt, thank you so much for those remarks. So that concludes the remarks by all 6 of our speakers in the first panel. And now what's going to happen is that all of them are going to come back and I am going to pose some questions to them. I do want to note that Director Randy Wagner was not able to stay in the webinar for this Q&A portion. Her role will be taken by Piotr Kramarz, who is the chief scientist of the ECDC. And I'm going to start with him. Dr. Kramarz, we heard Director Randy Wagner say that 3 key things are improved infection prevention and control, prudent use of antimicrobials, and also pressing for novel antimicrobials to come to market. Obviously, these need additional resources, especially in contexts and countries where healthcare expenditures are already overstretched. How do you see parsing this problem?
Thank you very much for the question. Before becoming an epidemiologist, I worked as a practicing physician for almost 10 years in a hospital, and to me, this is a question of a lot of suffering. You've seen it, or we've all seen it from the testimony at the beginning of this meeting, and I experienced also the feeling of desperation as a clinician when I had to treat people with this type of infections. So it's first and foremost for me a question of preventing suffering. But in economic terms, there are some estimates, I believe, from OECD from year 2023 that show that the costs related to antimicrobial resistance, they amount to almost 12 billion euro in Europe in just in 1 year. And the costs come from the direct treatment costs, of course, but also lower participation in the workforce, premature deaths, disability, and other losses of productivity. And I believe we should see the costs of implementing this package that was mentioned here, the One Health mixed package of interventions, as an investment, really. There are some data showing that, or some estimates showing that every euro invested in such a package would result in about €3 gains against the cost that I just mentioned. So I would rather reframe it as that these investments should be seen really as investing into prevention, and it would result in gains, economic gains, and also, of course, gains in health.
Thank you so much for that response. I want to ask a question now of Director Domenech. Dr. Kramarz just talked about investments, and you described to us that you have made investments in gamifying AMR for young people through initiatives like the Beat the Bug game. Why did you choose that particular target group? Why target young people? And I'm also interested in, if this works, how you'll expand this to other age groups and also other platforms.
Thank you. We chose this age group because this is the age where they really understand what they need to do, and this is part of an education. So they understand the threat, and at the same time they can quickly apply the good practices. Also, we decided to do this, and this is the age group of between 12 and 16 years old, more or less. And we decided to do this in the member states where the Eurobarometer showed that there was less awareness, and that's Bulgaria, Romania, Hungary, Spain, Greece, and Cyprus. But obviously, this target group is not that easy to reach, and we've seen some examples by other speakers, and that's why we thought to go or to use Fortnite, which is the largest online game in the world with more than I think it's 650 million players registered, and create a game which shows the inside the body with challenges across the way, with quizzes, with tips, to get scientific knowledge in an entertaining way for this audience. And we used influencers who have millions of followers to play the game. And it was launched on the 2nd of November. And actually, we have already had 3.3 million views on only for those followers that were seeing how these influencers were playing the game. And nearly 15,000 playing the game, those people that playing the game, spending on average 31 minutes. 31 minutes on a game is huge. The average global figure for a classic Fortnite game is 20 to 30 minutes. So it means that they were really playing the game all throughout. We also had a social media campaign around the game, which reached almost 4 million people and got 50 million impressions and generated nearly 110,000 link clicks to our AMR campaign platform, which means that the multiplying effect of this game is clearly seems to be working. We will have the overall impact in a few days. Today, as I was saying, was the last day, and we will be presenting the winners of the game. But yes, this is definitely a good practice. We don't exclude enlarging these to other age groups, but probably using also other platforms. Thank you.
Those were really astonishing numbers. That is a lot of people on that platform playing that game and learning about the issue. It's fantastic. I would like to ask more about that, but I'm going to move on to another question for another panelist, this time to Executive Director Cook. I was really struck by the percentages you voiced of how much success there has been in reducing antimicrobial use in agriculture. And I'm curious what your thoughts are about why that's working so well. Why is it that the veterinary side is responding in this manner, and what is it that they perceive about the risk of overuse of antimicrobials that might provide a lesson for the human side?
So thank you very much. And indeed, this is a really good question, because I think what we've seen is by focusing on monitoring and consumption patterns, we can make a difference. And part of this is because we've raised awareness among the vet and farming community about the risks of inappropriate antibiotics. We've asked stakeholders to contribute to understanding what the patterns are, and just by focusing on this in a way that everybody understands has made a real difference. Now, what sort of lessons can we take from that on the human side? In fact, we're already taking some pointers from the work we've done on understanding consumption to look at the real world evidence on use of certain antibiotics on the WHO watch list, and to see how often and how widely those antibiotics are prescribed across a number of European countries. And we're able to, through these studies, we look at the electronic health records, and we're able to understand not just how often they're prescribed, but we can break it down into factors like age, sex, and country. And we can also understand the reasons for their use and how long the treatments last. So you can imagine that the better understanding of the actual use and practice helps us understand the differences that may exist across countries, and it helps us target our recommendations in the most appropriate way. So I would say we're learning from what has been done on the veterinary side. We've seen that can make a real difference. So the more we know about how antibiotics are used, by whom, in what way, helps us target what the appropriate interventions will be.
It's a really fascinating evolution. Okay, I have a question now for Executive Director Url. So the initiative that you shared about use of reclaimed and reused water is really interesting, but I'm curious to know, how does EFSA plan to integrate findings about AMR presence in water into surveillance and risk assessments? This seems like it's going to be quite a complication.
Yeah, thank you. You raised an important question, which I think shows a positive trend to enlarge the picture of AMR from veterinarians, farmers, and physicians to the environment. Something that has been neglected for many decades, when there was a bit of even a blame game between physicians and veterinarians, who is more responsible for the growth of AMR. I think we have overcome that. We are collaborating now, but now the environment comes more and more into focus, and we learn that the environment is an important compartment where bacteria can exchange genes and can learn, so to speak, from each other how to become resistant against antibiotics. And now with the need to have more sustainable agricultural system, the reuse and reclaiming of water becomes more and more important. And we have learned that with this reuse of water, let's put it that way, there can be a recycling of resistance in humans via sewage sludge and via irrigation water. It can come to a sort of a recycling of resistant genes from humans back into the food chain, back to the humans. So we are very interested in that. And our panel for biological hazards has produced a scientific opinion on that, and showing how wastewater used for irrigation is an important source for antimicrobial resistance. And we also have launched a grant with a consortium of EU institutes, where we want to generate data to learn more about how this works and how we can fine-tune our monitoring systems to be, so to speak, at the edge of what we should know, so that we can prevent this circulation and spread of resistance within the food chain.
Thank you for those remarks. I'm going to turn to Advisor Lofo Wong. As a journalist, I am always in search of the stories of everyday people to transmit the important messages about issues to the mass audience. So I'm absolutely fascinated at the breadth and the success of the patient-centered approach to communication that you've taken. That focuses on people's suffering and their experience of AMR. How are you going to use that approach to transmit to the mass audience that AMR is a shared responsibility as well?
Thank you, Marian. A very good question. I'd just like to highlight that we do not only focus on people's suffering and patient stories, which of course has its place on the one hand to bring the message closer to home and say, well, this could happen to me, or this happened to a person that was very much like me. But we actually, with the stories book that I showed you earlier, we're taking one step before that and focusing on people's stories. And that could be it could be anecdotes. It does not necessarily have to do with the disease itself, but just perceptions of the risk and how they came in touch. I've got to learn about antimicrobial resistance. So we are taking many approaches, and the AMR survivors group is a really effective one. But we're also dealing with other, as mentioned, other stories on what brings it closer to not only to patients or caretakers or your neighbor, but also the healthcare workforce. Actually, there's luckily a great focus on engaging the community and engaging patients, etc. But there's still a lot of healthcare workers that are, have similar ideas that AMR is not really their business or doesn't feel very much in their education or in their day-to-day work. So we have different messaging to do, different ways of reaching different groups, different ages, different cultural backgrounds, different professions, etc. So I think we have our work cut out for us, but we really need to work towards this, because I think within this AMR community, as we can call ourselves, we pretty much know what we're talking about. And I'd be very surprised if there were people on this webinar who had never heard of antimicrobial resistance. So we are a little bit talking to ourselves. We need to find a way to reach people outside our AMR bubble, if you will. And one of the things we're working on with that, if you allow me, is to think a bit more about the narrative. Like, what are the messaging that we're using? Antimicrobial resistance itself is very difficult to understand. But if we bring the discussion back to that it has to do with treatment or the failure of treatment, difficult to treat infections, that resonates better with people. And then one other thing that I mentioned or that I noticed here is that we are talking about combating antimicrobial resistance, the fight against antimicrobial resistance, very sort of warlike rhetoric that may or may not reach a lot of people. I think we have to deal with, are we looking at the gains or are we looking at the losses? There's many things to consider when we talk about antimicrobial resistance and the different target audience that we need to reach. Thank you.
Thank you so much for those thoughts. In fact, the question of whether we are talking about this as a battle is a really interesting discussion to be had about communication strategy. I want to ask a final question of this panel to Director Norstedt, and that is this. Going back to your point about increasing involvement of the social sciences and increasing citizen engagement, how do you see this upcoming European One Health AMR partnership addressing that, bringing these other communities into the discussion?
Thank you. So it's a very important aspect. And here, I think we can look at it at three levels. One, of course, is in terms of governance. One is in terms of, as I already mentioned, in terms of engaging SSH more into projects. And the third level is actually citizen science as such. So if we start on the governance, it is really important that we do have civil society organizations working hand in hand with the partners in the governance. And it's expected here that relevant patients and public health organizations, which are active on AMR, will be part of the governance and in the various strategic bodies of this partnership. When we look at projects, there is an existing toolkit on the Patient Engagement Resource Center, which is a joint initiative from one of the research infrastructure funded at European level called the ATRIS, and also the European Patients Forum and the European AIDS Treatment Group. And it's currently being looked at if this Patient Engagement Resource Center also could be repurposed by this upcoming One Health AMR partnership to increase the direct participation and to ensure the meaningful users' involvement of RNI. But I've so far only talked about patients, and I want to come back to the SSH community and the social and humanities communities. I think it's really important that we look at the social aspects much more, because we know behavior, for example, is a very important area. And that they should also be involved much earlier into setting, the scope in terms of research activities. And here we see that this is something which is cross-cutting for many, many different scientific areas. And it was interesting to hear from Roser, for example, about the games, etc. And I think that there is more that can be learned and also could be picked up into this partnership in terms of what could be done in terms of developing new innovative tools, etc. Also, we should expect the partnership to collaborate with WHO and the task force of AMR survivors in also identifying opportunities, how to meaningfully engage patients, survivors and carers into the research that will be done. Something that we haven't talked much about, but I would like to bring on the table here, because we often forget it, it's social innovation and also citizen science, which is something that we also could look at, because this is not only something that concerns healthcare systems and patients, it actually concerns all of us. And as also mentioned, I think it's something that we need to bring the broader sector of society in to work together with us in terms of generating the knowledge and the importance of the various aspects we have in these areas and the threat that is really, really imminent. We called it the silent pandemic, and it really concerns all of us, and it's rather urgent.
Thank you for those remarks. That concludes our first panel in this event today. Thank you to all 6 of our speakers for representing their agencies and commissions and for contributing their unique perspectives to this incredibly important discussion. Now we're going to move to the second half of this event, in which we're going to turn from voicing questions of policy to hearing from patients and patient representatives themselves. Our 3 speakers will be Stefan Radut, who is director of the Association for Supporting MDR TB Patients from Romania and is himself a former MDR TB patient. Our second speaker will be Anka Toma, who is Executive Director of the European Patients Forum. And our third speaker will be Hanna Bartakova, who is Director of Health First Europe. Welcome to all 3 of you. We will hear from Stefan first.
Hello, thank you.
Please go ahead.
I will start my presentation. I'm Stefan. I'm 38 years old and I'm from Bucharest, Romania. Like you say, I'm a former MDR TB patient. In 2011, after I had been coughing for 2 or 3 months, I visited the family doctor, which gave me some medicine for cough. When I started to sweat very much in the night, I had an X-ray and I received the TB diagnosis and I was hospitalized. It took 2 months until I received the diagnosis of multi-drug resistance TB. As the rapid test for rifampicin resistance were not available back then. The usual duration of TB treatment used to be 6 months with 4 different antibiotics, around 12 pills each day. However, for treating the MDR TB that I had, the treatment was for 2 years with 18 pills and 1 injection per day. Very quickly after starting the treatment, I understood that not only I had to take the treatment for 2 years, but I had only 20% chance of healing. It was the worst period of my life. I stayed 5 months in hospital. I got depressed, and I was thinking how it would be when I die. The side effects of the medicine were horrible. I spent a lot of days in bed. I was in a pain every day. I was nauseous. My life stopped. I lost my job and I became helpless. After 8 months of treatment, I realized that my hearing is going down. It was very strange because I was able to hear noises, but I didn't understand the words. This accentuated my depression, and it took me 1 year to accept hearing aids. Hearing loss is a permanent side effect of the injectable drugs, but without it, I had zero chance of healing. Even so, the doctor recommended me a surgery to remove half of my left lung because a very big risk of relapse. Again, I was in hospital and I needed another month of recovery while I continued that horrible treatment in the same time. As the overall treatment consisted of more than 14,000 tablets and more than 300 injections over 2 years, it and the treatment in general affected my liver. And all this happened because my tuberculosis was resistant to antibiotics, and that time there were not effective drugs to cure MDR-TB without serious side effects. That means a lot of pain for patients and also for their families. In the end, I was lucky, and I got cured with 30% respiratory capacity reduced and almost half of my hearing lost. 11 years after healing, if I use stairs, I need to break every 2 floors. I get tired very quickly if I can carry something. It is very difficult for me to walk on the mountain or to run. Anyway, I cannot run more than 1 minute. This is just the medical problem. Another chapter was about the mental health challenges during those 2 years. The experience was very difficult for me, and I could not have managed to follow the entire treatment and get cured without the support of my family and without psychological support. Understanding how the important is that support, I decided to get involved in the Association for Supporting MDR-TB Patients from Romania. Now I'm the director of the association, and we provide psychological support and peer support for TB patients. Also, we are involved in a lot of advocacy campaign and also awareness campaign. Now, I'm married and we have a 4-year-old son. Sometimes the communication is difficult, and my wife has a lot of patience until I understand what she tried to tell me. It is very difficult for me to communicate with my son. Usually I don't understand what he say, and this is very frustrating for both of us. So again, I was lucky one and I get cured, but we cannot rely on the luck to get healthy. For this we need effective antibiotics. And we need to learn how can reduce the antibiotic resistance. We need to learn how to use the antibiotics prudently so they can continue to work. Of course, when it comes to TB about, we also needed good access to rapid tests that can timely discover if the infection is resistant to any antibiotics. Then it to be part of the treatment also ensure patients adherence to treatment to minimize the risk of future resistance to develop. Today, there are new more effective antibiotics for MDR-TB. The treatment is shorter and with less major side effects. Unfortunately, those new drugs are not available in all countries. It is important for everyone to make changes to protect those new antibiotics, to keep them effective against bacteria. Because in maybe 10 years, they cannot also become ineffective against resistance bacteria. Thank you.
Thank you for sharing that very moving experience that you've had. I will have some more questions about that once we conclude the panel and move to Q&A. But right now, I want to invite Anka Toma, Executive Director of the European Patients Forum, to present her perspective.
Good afternoon. I am Anka Toma. I'm also from Bucharest, Romania, but I have been working in EU health policy for a lot longer. I don't know how to start this because it is really humbling to hear the experience of Stefan, but also the one that was recounted by Gavin at the very beginning. And so I guess what I should say, instead of what I had prepared, is that antimicrobial resistance is something that can happen to every one of us. It happens really to healthy people, but it affects people with pre-existing conditions even more. And that's why the European Patients Forum, we have been involved in bringing these perspectives from people living with chronic conditions who have encountered antibiotic resistant infections throughout their pathologies and throughout their lives. The reason we emphasize the impact of AMR on patients with chronic diseases is because they already start as a vulnerable population. But as we heard, antibiotic resistance can happen to also ordinary, regular people walking in the street. Some of the examples we've received from our dialogue with patient communities include patients or people, citizens, persons who contracted an antibiotic-resistant infection from an accidental fall. Someone who breathed in a resistant pathogen. It is important to note these because in the end, antibiotic resistance can indeed affect everyone. But AMR affects patients' health in a significant way. It can lead to invasive treatment, like multiple surgeries. It can lengthen the time of treatment, like we've just heard Stefan talking about the difference between the so-called regular TB and the resistant TB. It can sometimes cause long-term damage with radical consequences. We can talk about the impact of sepsis or antibiotic-resistant sepsis that can lead to amputation in patients or to multiple reconstructive surgeries, like some of the patients we're talking to have recounted to us. And fundamentally, AMR can lead to death, and as we know, a number of people, estimated currently at 35,000, lose their lives to antibiotic-resistant infections every year in Europe. But we've also heard today that AMR not only affects the physical health, it also impacts the mental health of patients. Some patients start to feel isolated and depressed because perhaps they see how their antibiotics stop working over time, creating stress and anxiety. Or perhaps because they withdraw from social situations because they're afraid of catching new infections. Or perhaps because AMR causes long-term damages. So it's important to talk about the impacts of antibiotic resistance on people who live with chronic conditions, because they are at an additional risk. And by protecting them and supporting them, we can support also the entire society. And this is where my message is that patient organizations such as ours and our members who represent people living with chronic conditions can play a critical role. They can raise awareness by bringing patient stories to highlight the realities of AMR. They can develop capacity building and communication programs for patient organizations or for individual patients to communicate about AMR. They can collaborate with healthcare professionals and their organizations to discuss, implement, and monitor best practices in healthcare settings in collaboration with patients who are the recipients of care. They can also have a major contribution in providing trusted information and credible communications to their members, to patients, about important issues such as AMR and about the importance of prudent antibiotic use. For example, we're seeing that in communities, antibiotic consumption has risen for the first time after some years, and that is a concerning trend. Patient organizations do have the knowledge and the capacity of communicating with their communities and supporting antibiotic use. And then finally, patient organizations can help improve patients' health literacy so that they are better informed and better placed to use antibiotics when needed and as needed. I would stop with this. I would just highlight that from our perspective as the European umbrella organization of patient organizations and representing people who live with chronic conditions in Europe, our priorities are to support the prioritization of health literacy so that our communities are better informed about antibiotic use and about what AMR is and how it can affect people. We advocate for greater involvement of patient organizations in developing, implementing, and monitoring and improving AMR-related policies in healthcare systems and in healthcare settings. And finally, we advocate for supporting all countries in AMR in achieving AMR reduction targets, including through community engagement and patient empowerment. Thank you.
Thank you so much for those remarks. The role of patients representing organizations is so important, and we'll talk a little bit more about that in the Q&A. We have one more speaker, but before I introduce her, I want viewers of this event to know that we welcome your questions for this second panel of speakers representing patients in their various roles. If you have questions for them, please feel free to put your questions in the chat and they will be pushed to me and I will pose them to our speakers. Having said that, now let me introduce our third and final speaker of the day, Hanna Bartakova, who is Director of Health First Europe.
Hi, good afternoon, everyone. Thank you very much for hosting us today. As was said, I'm representing Health First Europe today, but mainly I am representing the AMR patient group that is being led by Health First Europe, which is basically an organization of 30 different patient groups across European member states, but also across diseases, where we are trying to amplify the voice of patients who have been affected by AMR, independent of any other disease that could have brought this resistant infection to them. So a lot has been said already about the place of patients in this debate, but I would just like to emphasize that we believe that not only patients should be included in the debate at all levels, but they should be the drivers of the discussions and of the change. Of course, for that, organizations such as ours or such as the European Patients Forum and others have the role to actually empower them to do that. So what I think is very important, first of all, is awareness and prevention, of course. So to understand actually what is antimicrobial resistance and how many people truly understand that it is not just a complication of another disease, that it is something that can happen to everyone anywhere. It is a condition that turn basically manageable infection into a life-threatening challenge. And this is something that really needs to be understood by everyone. As it was said already before here, we are a little bit, talking among ourselves. We know all what we are talking about, but we really need to ensure that people on the street actually understand what AMR is and how it can affect them, and how they can also prevent it. So powerful measures such as hygiene, vaccination, and antimicrobial stewardship are actually life-saving issues that need to be discussed. Another quite important issue that we are dealing with when we are talking to the patients is actually a dialogue that needs to be much more open and needs to flow way better between patients and healthcare workers and pharmacists, actually. On one hand, to ensure that the patients are heard, that they understand what is happening to them, that we avoid any kind of frustrations that can happen when sometimes patients may have the impression that they are not being treated because they are not getting antibiotics that they actually don't need, but they might not know it. And then furthermore, actually to know once they are prescribed antibiotics, how to take them, the duration, the dosages, and what are the risks actually of misusing these antibiotics. It is a collective responsibility that we all have, and it is only through this kind of dialogue and this empowerment through knowledge that the patients are going to be able to be actors in this fight and in the change that we need to bring upon to bring solutions to AMR. Another issue that we are very busy with, and that has been already discussed here, of course, is the equal access, not only to antibiotics, but also to other solutions, screenings, early diagnostics, etc. We know that disparities exist very much between, well, not only member states in Europe, but all over the world. And we know that the issue of antibiotic shortage in Europe has highlighted a critical need for an independent and resilient supply chain. From the patient perspective, this necessity to basically rethink the economic model of antibiotic development and production needs to be aligned with public health needs. And patients need to understand actually the process of pharmaceutical development. Why would a shortage happen? How is it happening? And then how can they also play a role in the change of this paradigm? Last but not least, I would like just to mention something that is absolutely critical for our patients, is that beyond physical health, it has been mentioned already, AMR takes a profound toll on mental health. Patients and their families are often feeling abandoned, lost, and they do not understand what is happening. They do not have access to the right information. And for those who supported loved ones through this ordeal of resistant infections, or have tragically lost loved ones, this is a very heavy burden to actually bear. And the process of naming AMR as a cause of death or part of a cause of death is absolutely crucial to be able to kind of bring the possibility to grieve, to understand the why, and to learn and to push for change. So just to conclude, I would like to share with you a short patient story from our community that was shared with us, and that kind of illustrates everything that has been said today. First of all, that it can happen to anyone. So we will be talking about a 20-year-old person, a guy, very healthy one, a rugby player living in Germany, who started to feel unwell and who started to develop an abscess. So he went to the ER, where he was diagnosed with MRSA. So that's methicillin-resistant Staphylococcus aureus, which is a resistant bacteria. He was scheduled for surgery on his abscess right away. And he got antibiotics after that surgery, but the antibiotics didn't work. And therefore, he needed to wait 1 more week before the necessary tests were conducted. And so the right antibiotics were prescribed. In the meantime, he developed another abscess, so he needed to have another surgery. And this is basically a young person, very healthy, who most probably contracted this infection by going to the gym. So it is something that you would do every day in your everyday life, and it can actually cost you. For now, it has been 1 month that he has been on sick leave. Hopefully now the antibiotics are working, but actually we are still not sure if they are going to do the job. So I hope that yes, but this is where we are. And one testimony that he was also sharing was that he felt very much left alone with this information. He didn't get enough information from the healthcare workers. He needed to basically Google everything about his condition, and it was only because he had a great support from friends and family that he was able also to cope with the consequences of this infection, because it's a contagious one. And basically there are rules to follow afterwards once he gets home, to be able to not to transmit the disease further. And he didn't really get any kind of support from the hospital, from the doctors. So this kind of illustrates all in all the support that we need to bring to patients, so they then in turn can understand what is happening to them and be the advocates for the change and be part of the conversation and really push for the necessary dialogue at political level, and to be really at the center of this discussion, because in the end this is the patient care and the patient outcome is what is the most important in this fight. Thank you.
Thank you so much for those remarks. The story that you just shared of the young man, incredibly healthy, going to a gym and infected as a result of his attempting to take health protective behaviors is really moving and really underscores how much anyone is at risk. So I want to ask a couple of questions of all 3 of our panelists, and I just want to remind viewers that you can pose questions to them as well. If you put them into the chat box where you are watching, those questions will be relayed to me. But let me start. Stefan, I want to go back to you. Your story is so moving, and your journey from being a patient to being director of an NGO and speaking on behalf of other patients is very inspiring. You made the point that from when you were treated to now, treatment for MDR-TB has improved and the drugs have improved and the courses have shortened. But I would like to hear a bit more about the disparity in access to drugs across Europe. It does, and elsewhere in the world, it does sound as though these benefits are not being extended to every patient who needs them.
Yes, in last time we had a new medicine for treating MDR-TB, and we have new treatment regimen for MDR-TB, which is very, very well, because now the treatment during 6 or 9 months, and this is a dream. The patient take less pills every day, and this new medicine doesn't have a lot of side effects. But the worst part is that medicine are not available in all countries, and unfortunately, they are not available in Europe, in west of Europe. It is a little bit hard to understand why maybe in the most civilization place we don't have access to new medicine, and that medicine maybe are less to have access in Africa or in Asia. In comparison with 10 years ago, we have also better testing opportunities for see the antimicrobial antibiotic resistance of bacteria. Like a comparison in numbers, 10 years ago, the doctor and the patient wait 2 or 3 months for receiving the test result. But that is in the best scenario. Now we have this result in 2 hours, and this is a huge progress. But if we have these good points, we need to protect this good progress, and we need to make intervention for this bacteria to don't become resistant for these new drugs. And for this, we need to support all the patients in the treatment adherence, and support them and help them to respect all the medical indication. And at the same time to advocate to have access for all the patients who need these new drugs.
Thank you for those comments. Anka, let me go to you. You were very eloquent in talking about all the things that patient supporting organizations, patient representing organizations can do on patients' behalf. But what challenges do you feel the organizations face in getting attention for this problem or attracting funding so they can do more of the work that they want to do? I believe you are muted. Let's see if we can get you unmuted.
I am unmuted now.
There.
Sorry, I was just starting. It's an excellent question, and listening to Stefan just now, the challenges are very complex to us as patient organizations and umbrella patient organizations to be reaching to be able to support this work. In terms of communication, a lot of antibiotic resistance survivorship is not necessarily considered as a condition in itself. And once people have gone past that, a lot of the time they get on with their lives, and that's why it's been, and having worked in these last few years with Hannah, with the AMR patient group, with ECDC, with WHO, we know that compared to how many cases of antibiotic resistance there are actually very few patients, and even fewer patient organizations focusing on this. So it's really important that these voices are heard, because it's a threat to all of us. When it comes to resources, I think it's not just a question of resources for not just for patient organizations working on AMR awareness. It's also more broadly a question of where are the resources invested in raising health literacy that can underpin a lot of public health action on antibiotic resistance, actually. Where are these resources going, and do they exist in the first place? And my argument and our role as an umbrella patient organization is to say, hey, if you want to raise awareness in your general population about a topic as important as AMR, then you have to start with those organizations who speak the language of patients and who are regular people who speak the same language as regular people. It was scary to me. I worked on antibiotic resistance when the European Antibiotic Awareness Day started 18 years ago, and the community use was a problem then, and it remains a problem. We clearly have not raised enough health literacy, and we know in Europe the investment in health literacy has been minimal at best. And we really must work with that. And I know that the best message and the most credible for communities will come from community organizations.
Thank you so much for raising the question of health literacy broadly in the population. But I'm also struck by something else you said, which is the unique position that AMR survivors are in. And I think that goes to Hannah's point that AMR is not just a physical problem, a clinical problem, but is also a mental health burden. Hannah, I would love to hear you talk a little bit more about that, the shape of that particular challenge in this community.
Yeah, I mean, it was, I think that Stefan also talked about this issue. Basically, from what we hear from most of our patients is that, first of all, the lack of information and the lack of communication is already a first burden, because it's very stressful. You don't know what is happening either to you or to your loved one, and nobody is giving you the right information. You just know that the solution that was brought in the first place is not working, and the situation is getting worse, which is a very stressful situation to be in the first place. But then once either a solution is found or is not, and then you have a very bleak outcome of the AMR. It's very rare that it's actually going to be pinpointed as AMR, because it still has this kind of stigma of failure, basically. So we failed to give you the right antibiotics, so there was a very bad consequence to that. So people would say more likely there has been a complication. There has been a complication of your cancer. There has been a complication of your disease. There has been an infection, usually, sepsis or something like that. That is a very global kind of name to something that actually can be explained and can be understood. So sometimes also patients have the impression to be undermined. Why don't you tell me what actually exactly happened, so I can make my peace with it, I can understand it. And then very often those patients then go actually into advocacy and into fight and into, okay, so now we need to do something else. We need to create a group of people. We need to talk about it. We need to, because they know what happened to them. But sometimes people have been suffering from an infection, let's say a cough, for a very long time, and they don't even know what happened to them. They don't know that it was AMR resistance. It's just that in the end something worked, and they come out of it with very bad health, with severe consequences, but nobody tells them what went wrong. So all these burdens on mental health are very difficult, and this is also something that we are doing. That we are trying to create a community of patients. As Anka was saying, there is not that many patients that would actually present themselves as AMR patients. But we are trying really to get them to speak to each other and to have this peer support between people who suffered from AMR or who have families who suffered from AMR, to have this kind of supporting community.
Thank you for that. Let me ask one more question of all three of you. Here we are in the midst of European Antibiotic Awareness Day. It is a unique moment in which to shine a light on the challenges of AMR in policy terms, in clinical terms, for patients and their families. For each of you, what's the one thing that you would like people to take away from this viewing today, or the one action you would like to see governments or civil society take? What is absolutely top of your wish list? And Stefan, I'll start with you.
Maybe it will be very helpful to increase the awareness about the antibiotic resistance, to increase the learning about that. The people don't know many information about antibiotic resistance. General population, I say, not specialist or patient organization, or the patients in general. The general population doesn't have information. We'll say that we are resistant to antibiotic. We like me, the man, the person, not the bacteria. Usually we need, when you have a disease, we like to have the access to the last medicine that was discovered. But when we talk about the antibiotics, maybe it's not so good to have access to the last antibiotic that was discovered. Maybe it's better to start with an old one. And the people doesn't understand this. And maybe regarding the general population, we need awareness. Regarding governments, for sure, they need to put money for develop new medicine, and not only medicine is important. It's important how to educate the patient who take that medicine. It is important how to support that patient who take that new medicine. And finally, we need to start to use the new antibiotics, and government must to pay for that. And I think it's enough.
Anka, let me ask you, your top priority, the thing you would most like people to exit this event thinking about.
I would like to see representatives of the stakeholders who were in this event, policymakers. ECDC, it plays such an amazing and an important role in bringing the data. Policymakers, WHO, ECDC Commission, member states, health professionals as well, of course, health professionals and patient organizations. I'd like for us to come together at each country's level. We don't have to be there. We need our members to be involved in there because they speak the right language. To come together and develop awareness programs that are focused on positive messages and on how everyone can contribute to keep antibiotics working, and how everyone has a role, from managing their own health to managing expectations to not demanding antibiotics to resisting time pressures, and I'm talking about all the little pressures that do take place at the individual's level and their interaction with the health system. So I'd like to see that joint work come together, and I'd like to see adequate resources allocated to those programs to reach every single citizen, because everyone in their life will encounter antibiotics, and everyone in their life is at risk of resistance, of antibiotic-resistant bacteria, of course.
Anka, thank you for that. Hannah, the final thoughts from you, your single most important priority or the message you'd like people to leave with.
I think that both Stefan and Anka said the both two most important pillars, which would be really awareness and enough resources to be able to spread that awareness really everywhere. So I think that also what would be really important for us, it's all part of the same package, but I think that also targeting the awareness kind of or the dialogue messages to healthcare workers and pharmacists to be able to really foster the dialogue between patients and healthcare workers. It's incredibly important because being, interaction with healthcare workers can for people be sometimes intimidating. We don't have the knowledge to be arguing with anyone, with doctors, with nurses, etc. But the dialogue needs to go both ways to really get the important information for the patients and for the patients to be also able to ask the right questions. So I think that part of the awareness that could be actually quite easy, it's already there because we all go to see doctors, we all go to see pharmacists, we are all the time in interaction with them. And that dialogue should really be helpful to spread the word about AMR.
Thank you so much for those comments. And thank you, panel, for emphasizing the patient perspective and the need for patients to be spoken for in the healthcare system and by patient organizations. To remind you viewers, we have been hearing from Stefan Redoute, a former MDR-TB patient and director of the Association for Supporting MDR-TB Patients, Anka Toma, who is executive director of the European Patients Forum, and Hanna Bartakova, who's director of Health First Europe. Thank you all. So let me wrap up this day for us. We heard from these three patient representatives, and we also heard from incredibly important agencies, the European Centre for Disease Prevention and Control, the One Health Directorate General for Health and Food Safety of the European Commission, the European Medicines Agency, the European Food Safety Authority, the World Health Organization and its Regional Office for Europe, and the Directorate General for Research and Innovation of the European Commission. And what I think we heard from all of them, from patient organizations and patients and from these policy organizations, is both how critical a problem AMR remains. And despite the enormous successes we heard about in some of the policy presentations, how many profound challenges there are still to be tackled. And as we heard from the patients as well, how much needs to be done in terms of health literacy, in terms of supporting patients, in terms of regularizing the power imbalance in the healthcare system to make the patient experience better. We started this day by talking about the necessity of making patients visible in this invisible epidemic. And that is what I hope everyone will leave this event with, the sense that, as we said at the start, that though the pandemic of antimicrobial resistance may be invisible, patients should not be, and they are not. And as we go forward from this day, we will keep patients in mind, all of us. On behalf of all of those agencies and these patient organizations, thank you so much for watching this event today. I'm Maren McKenna. Good afternoon, good evening.